What's up, everybody, and welcome to Cannabis. Today we have a special guest. We're doing another talk and Toke today, and this goes back to something that we touched on actually earlier this season, that hemp is cannabis too, and we have a special guest today to talk about the benefits of hemp, and let's actually get into that right away. This person is an RN, that's a registered nurse, BSN, has worked in healthcare for 15 years with extensive experience in emergency medicine, critical care, heart failure, surgical services, and case management. This person has trained and worked at some of the best academic medical centers in the country and is board certified in critical care nursing. She also has a certificate in cannabis nursing through the American Association of Cannabis Nurses. She was awarded a continuing education scholarship from National Nurses United to Rutgers University Women's Global Health Leadership Certificate Program, lots of words. In 2015, she was awarded the Illinois Nurses Association 40 Under 40 Leaders in Nursing Award, not the only award we're going to talk about with this person, and was a scholarship winner in the 2012 Nurse in Washington Lobbyist Internship. She has remained an active member of the American Association of Cannabis Nurses, National Nurses United, Patient Advocacy Alliance, and Sigma Theta Tau Nursing Honor Society. She has testified and lobbied for healthcare, patient safety, nursing, and cannabis policies on the municipal, state, and federal levels. Folks, please welcome Rebecca Abraham, RN, BSN. Hi, Rebecca. How are you?
Hi, good.
Thank you for coming. Thanks for coming on. This is so
Yeah,
cool. I'm
thanks
so
for
excited.
I'm so excited.
It's always an interesting thing, talking to somebody who is a registered nurse about cannabis, because there's so many questions out there. There's so much, kind of should I, shouldn't I? I mean, I have my awkward moments with my primary care physician as well, talking about cannabis, and we're so happy to have you because we'd like to, kind of get into that.
Yeah.
Before we start, what's most important, please tell us a little bit about yourself. Tell us about your journey and about how you became a certified cannabis nurse.
Yeah. So, gosh, I was interested in cannabis since nursing school, which wasn't that long ago, but my senior year, I did clinicals in oncology and palliative care, and I did a policy project on cannabis. Well, um, I got a lot of like, ooh, how could she? What is she talking about?
Oh my, she's talking
Uh,
about the devil's lettuce.
yeah,
Can we?
there were some professors that didn't love me. I actually was told multiple times. I won't name them because now I see them often. But I was told multiple times, like, you're not going to be a good nurse. Like, you're too left. Your jewelry is too chunky. Your hair's too long. You're just, your professionalism is how you look. It was just very old fashioned.
Right.
And I was very like alternative. Like, I took all the electives that were like policy and art and nursing. That was just me. So I've always had an interest in kind of, I use Gwyneth Paltrow as an example. I like her vibe. So I like that, but I like being alternative, but with science. So that's kind of what got me interested in cannabis. I've always liked cannabis.
Right.
I've always enjoyed cannabis. If you're going to use a recreational substance, it's really safe overall, significantly better than alcohol, cigarettes, or really any recreational drugs out there. Psychedelics kind of have their merit, we're learning too, but it's super safe. You can't die. There's no lethal dose of cannabis. So kind of knowing this, it's always been an enjoyable preference. But then medicinally, there are 30 therapeutic uses of cannabis and growing. It's a really interesting plant, and the way it acts on our body is kind of like nothing else we know about. It acts on our endocannabinoid system, this very complicated neurotransmitter neurologic system within our central nervous system. We don't really even understand how it works. We're starting to get more and more knowledge about it, but that was only discovered in about 1990. If you compare that to other other neurologic systems, there we go. We've been studying the endorphin system that opioids act on for about 100 years. So We just don't have the knowledge, but what we know about the endocannabinoid system, we know that it is a prehistoric system that seems to exist in some plants, most animals, even animals that are kind of barely have a neurologic system. Mollusks and shellfish have an endocannabinoid system.
I was just going to ask, what strange animals on this planet also have an endocannabinoid system?
Yeah,
But all right, cool.
and they,
So
are they
brachiopods. Brachiopods are big on the endo. Got
yeah,
it.
like I mean,
Cool.
like how they're barely animals. Like how do they have this like complex neurologic system? If I went to you and I was like, "Hey, I have this flower. It treats constipation. It also helps with diarrhea. It makes you happy, but it also relaxes you if you're anxious, and it helps depression. It helps you focus, can help PTSD. It also helps stomach aches. It also is an anti inflammatory and helps pain. It helps you sleep, but it also energizes you." That sounds like fake, right? But what's interesting is because of the endocannabinoid system and how strangely unique it is, cannabis really does do all of those things, and those things are documented in case studies and research, and we're still learning a ton more.
This actually leads me actually into something. You work in an organization called Acute on Chronic.
Yeah.
And I was actually really curious if you can expound on that a little bit more, because it looks like that you offer a number of services for folks that aren't just cannabis curious, but are actually at that point of their life where they're ready for care.
Yes. Yeah. So I am the president and CEO of Acute on Chronic. We are a cannabis nurse and clinician practice. So cannabis nurses, your audience is probably like, what the hell is a cannabis nurse? I'll tell you. It's a super new nursing specialty. Most of what cannabis nurses do, because there has been a gap in care, physicians don't get reimbursed for talking about cannabis, and there's a lot of policies if they work in a hospital system that prohibit them from talking about cannabis. And they would have to seek out that education themselves. Physicians are just as overworked and as busy as the rest of us. They don't really have time for any continuing education that doesn't directly affect their daily jobs, especially continuing education that they could be punished for. So there's this huge gap. If you go to the dispensary, bud tenders are very knowledgeable about the products. However, there's a gap in science there. There are the occasional dispensaries that do have people with biochemical degrees and molecular science that are super, super smart. But the majority of bud tenders know the products, do not know anything about health and wellness beyond kind of what they should know. So there's this gap. Patient doctors send the patient to the dispensary for advice, and the dispensary sends the patient back to the doctor to advice, and no one could give it. And so I decided, what do nurses do? We assess and we educate. So that's what I decided to dedicate my life to, was growing cannabis science and cannabis nursing. So what happens is when people come to me, I do an assessment. I educate them on cannabis because it's a paradigm shift. We're taking something that we've been told for 100 years is poisonous, kills our brain cells, makes us crazy, will land us in jail. And we're saying now, like, wait, no, it's legal. This is actually really good for you. Just pretend like we said nothing for 100 years. So I have to flip that in people's brains, but then I take the research and I apply it to what's going on therapeutically in that patient. So I have a lot of oncology patients. They have a lot of trouble with pain, anxiety, nausea, vomiting.
And cannabis is good with those things, I
And it's
hear.
good with many of those things. So they come to me, I do an assessment, I see what medications they're on. I make them a nursing care plan. I use nursing diagnoses. And any nurses watching this is like crying, because nursing care plans are the hardest part of nursing school. And you never think you're going to use them again. I use them every day now, because it's how we have to do our work. I don't want to step on physician toes. I'm not a provider. I'm not a physician, nor do I pretend to be. So I make this care plan. I list about 5 to 6 products and dosing ranges that the patient could try. That's within the manufacturer's instructions. And I tell the patient how they could use the products and how they can stay safe, and which products will work best for them by kind of translating this heavy scientific literature towards clinical applications. I take that care plan. If the patient allows it, I share it with their physician. If their physician's open minded, they'll be like, cool, thanks for the heads up. I'll titrate down these other drugs. If the physician is like, what the hell is this? Who are you? Why do I care? I do try to educate them and say, like, well, let me tell you about cannabis. I really want to collaborate so we could work together for your patient. That works the other 50% of the time. Patient has a couple follow-up appointments to get the right dose because cannabis is a biphasic plant, which means that the effects of the plant change with the dose you use and the cannabinoids and the terpenes. It's very dose dependent. So it takes a couple of tries to find the right dose. And that's what I do for patients. We also do patient advocacy, which includes finding somebody in nursing home for placement, finding a good home health company, finding good alternative practitioners, finding a second opinion. Yeah, that's kind of what we
That's
do.
awesome. That's awesome. That's great. I mean, there's a lot of folks out there right now, once again, that are cannabis curious right now, and they're concerned about, having a number of, products kind of, put in front of them and being like, is this going to be safe? Somebody, in a position like you can bring them a lot of comfort and, not just saying, oh, these products work for you, this dosage works for you. I know that this work, from a pharmacology perspective, like I know that this isn't going to react with, a prescription that you're taking kind of thing. So there's a lot of comfort that comes in that. There's a lot of value in that, and that's super awesome. Thank you
Yeah,
so much for the work that you're doing, and
yeah,
the peace that you're bringing a lot of these folks that are in chronic pain, or or terminal, or at hospice, or
yeah,
something of that nature. I think that's great. That's phenomenal. There's something that actually that you talked about, talking to your doctor about cannabis. It's awkward as hell, right? For
yeah.
me, my primary care physician doesn't like, well, I shouldn't say he doesn't like it. He kind of rolls his eyes. For one thing, I smoke. For another thing, medical professionals don't really seem really open about speaking candidly about cannabis. Do you think that's starting to change, or is cannabis something that's still kind of a, like, shame, shame, shame? We don't talk about these things.
It's definitely starting to change. And it's going to change with advocacy. So, like tomorrow, I'm doing a talk for an entire hospital of doctors. And the point I really want to hit home with them is even if they are deeply uncomfortable with cannabis because of 70 years of propaganda, and it's something they didn't learn, and there's limited research, that their patients are using it with or without me and with or without them, and there are really serious side effects if they don't ask about that. And I want to be kind of clear. So, by itself, you take cannabis, you take hemp. If you ate a bucket of it, you won't die. If you ate a bucket of THC, you won't die. You will feel deeply uncomfortable for many hours, perhaps days, but you won't die. Now, can I screen share? Is that allowed? This is
Okay.
why
Oh, yay. Oh,
physicians have
yay.
to ask if their patients are using CBD or cannabis or THC cannabis. So again, CBD, THC cannabis, safe on its own. These are all the drug interactions. That's a lot.
That is a lot. Oh my
Yeah.
God.
And that's what can mess people up. Two of the more serious ones, some of them aren't even listed. Two of the serious ones are Coumadin, a blood thinner. The other one is Plavix, is something, an antiplatelet we give to patients after they have a heart attack. I encourage all providers, like, even if you're uncomfortable, and I encourage patients, even if you're uncomfortable, it's important to say, hey, I'm doing this. To patients, if you are using THC cannabis or CBD, you could just say CBD to your doctor. It's the same. There has been a case study or occasional case studies about things going wrong with patients using cannabis and other meds. And typically, the research, I write a lot of letters to the editor in anger because there's a lot of like blanket statements without nuance that bother me. One of it is a couple summers ago, last summer, there was a paper that came out. Cannabis causes repeat heart attacks. It probably doesn't. What probably was happening is people on Plavix, remember the antiplatelet that cannabis interacts a lot with.
Right.
People were using cannabis, not telling their doctor, also taking Plavix after a cardiac event. The cannabis with the Plavix decreases the bioavailability of the Plavix, so their dose was less than it should have been, causing their stent to reclog, causing a repeat MI.
Wow. Yeah, yeah. I mean, I think like that conversation really needs to start being had with doctors. I mean, I saw on the list, like, I mean, if you're being prescribed benzos and you're taking cannabis and you're afraid to tell to your doctor about that, like, that's a big deal. That's no small
Yeah.
deal. So it seems as though that people, like doctors, are now starting to be, even if they're reluctant, are starting to realize it's like, it's time for me to have this conversation with somebody if I'm going to be able to treat the entire patient.
Yeah. And I mean, my husband's a physician, and so we talk a lot about like what are the implications of doctors putting like being ostriches, like what's the implications of physicians just being like, whoop, I don't know, cannabis, it's crazy. And it could be a lot. Cannabis interacts with a lot of chemo. A lot of people don't find me because it's hard to advertise. Dispensaries haven't been the best at working with cannabis nurses across the country. They've been a little resistant to us, strangely. And it shouldn't be that way. It shouldn't be that way at all. They should be working hand in hand with us, because if you work with a cannabis nurse, your patients will have better outcomes. They'll have a better time. They'll be safer, and you'll have repeat business. So it works with the capitalist model as well. People with oncology diagnoses go into the dispensary and they say, "I have cancer, help me." There are some patients on certain chemotherapies who should be using minimal doses of cannabis. Otherwise, it decreases the desired effect of the chemotherapy that's bioavailable, which could cause for chemotherapy failure. Me and my husband talk about, well, how many people are asking, are people asking about CBD? Probably not. Do they even know that's an option where the CBD can mess up your chemotherapy? Probably not.
Wow. Yeah, that's it's such a strange thing. It's like being in the doctor's office, I almost kind of feel like I'm almost in the principal's office. And it's really important for us to, to have these conversations and be open and honest about, I mean, let's be frank, human nature. Like, you're not going to shame people from not consuming cannabis, especially when people continually hear about the benefits of it. So let's just be real about it. Let's be open and have the conversation. Speaking of conversations, I need to think of some deep thoughts. I had a
That's
long
okay.
day today. I need to concentrate on some stuff. We're going to take a short break, come back shortly with our friend Rebecca Abraham, BSN, RNBSN. You got to make sure all the letters are there because it's super, super important. We'll catch you guys in a short while after a
Right.
concentration break. Cheers. What's up, everybody? Welcome back to this new Talk and Toke. We are talking with Rebecca Abraham, RNBSN, President CEO. I think if you want to, get super awesome, of Acute on Chronic. So, Rebecca, after some deep thoughts, really the one thing that I had to ask you about, I guess it seems simple. I wasn't thinking as deeply as I had hoped, but I was just really interested about your journey into cannabis. I always date myself in these things, but like, I was a dare kid. Were you a dare kid?
I
Was,
was a dare kid. Yeah. See, dare doesn't work. um, I made it my profession to do the opposite of what they told me. Sorry. Was it McGruff? Was McGruff in dare too? No, that
McGruff
was
was in dare. Take that, McGruff. I
yeah.
don't need any of your bullshit. All right. You and dare. All right. Look what I'm doing. And I'm not going to show.
Yeah. I do talk about the history a lot of cannabis. And so it's important to note. So I talk about this. So I was a dare kid. So people my age and older, it only gets worse from there. So like dare kids, and then you have kids of the 60s who were like told like they were like hippies that didn't want to work. And then you get even worse in the 50s, 40s, and 30s where it's all bad. The history of cannabis being criminalized actually lies in nothing scientific. There is not one scientific reason that cannabis is illegal. So keep that in mind when you're like, oh, I'm nervous. It was all politics. They wanted to keep a department open. Then they wanted to throw money at certain manufacturers during World War II, and those manufacturers were not hemp. However, they sneakily legalized hemp for wartime production and then made it illegal again because they needed it. And then when you get to the 60s and 70s, you get the first director of the DEA, Mr. Anslinger, who was deeply racist and he did not hide it, not one bit. He was friends with Henry Kissinger. And if you know the history of Henry Kissinger, he was not a nice man. He did horrific things to many people in Southeast Asia. And
Essentially, some of the assholes of history. Yes.
assholes of history are why we don't have cannabis. And actually, cannabis makes its journey to North America because colonizers and slaveholders brought it over with coffee to give to their indentured servants and slaves to essentially get them through the brutal conditions of slavery. It then becomes used as a medicine both by Western doctors as well as indigenous cultures. And then what do they do when indigenous cultures use it often as a medicine, but without often seeking a Western doctor? And it also becomes a recreational substance associated with art and jazz and various other cultures. They make it illegal.
There's plenty of people who have been scared out of cannabis, you know, and for me, like, I think of my mom. Like, she has hip pain, she has knee pain, and she doesn't sleep. And I try to explain it to her in that perspective. From, it's like, no, like, if you want your knees and your pain, like, to stop hurting, there's things that can help that. But still, like, it's, you know, it's the devil's lettuce, you know, it's just the way it is. Like, how do you find success and folks that are actually kind of like curious about cannabis, who are like, you know, will this work for me?
Yeah, a lot of success. Even folks who are scared. I get a lot of people where their children buy my services and they force them to talk to me. I've talked about the scariest part of like when cannabis goes wrong, right? I didn't talk about when cannabis goes right, which it does often. So think about every cannabis going wrong. Everything has side effects and everything has drug interactions. So if you don't use cannabis, you are not escaping side effects and you're not escaping interactions. You actually have worse side effects with many other things that do the same thing as cannabis and similar amount of drug interactions. If you have pain, CBD is heads and tails better to use probably as a first line defense than Tylenol and Motrin. Tylenol can hurt your liver if you're taking a ton of it a day. Motrin side effects, if you take a ton of it, GI bleeds, and then kidney failure. Like you could really harm your kidneys if you're using a ton. So if you have chronic pain, you can't rely on Tylenol and Motrin forever. Steroids have all of these things work, but steroids also have a lot of side effects to them. CBD in cannabis is a very potent anti-inflammatory. There's studies going back to the 90s and early 2000s talking about how it's about 30 times stronger than Motrin with pain relief. There's a study I show in talks that I do where they did a study of cannabinoids versus over-the-counter pain relief and opioids versus placebos, and cannabis performs well each and every time. It helps with polypharmacy. What's polypharmacy? Polypharmacy is when people are older, they're on a lot of medications, or if they're chronically ill, lots of medications. Cannabis helps because it does so many things, helps decrease the amount of prescription medications they're on, which kind of by proxy decreases confusion, decreases falls, decreases drug interactions, which you saw can have some pretty scary consequences. So yeah, I mean, there's something we say in cannabis nursing at our conferences. This is what the older cannabis nurses said. So there's waves of cannabis nurses. I'm like a second wave cannabis nurse. There was like a primary wave of 10.
Wow.
Early cannabis nurses were actually activists that became.
Okay.
Some of them were punished criminally. They were threatened by the federal government, legal fees. Like one of the earliest nurses, her name is Alice. I forget her last name. She's wonderful. She wrote a book too. She works with patients at a time. Her husband had glaucoma. Cannabis was the only thing that helped keep his vision. And she had like a decade-long fight with the federal government to allow him to get medicine. She became a nurse, I believe, because of that experience. So we say we see two things. Cannabis should be a first line treatment, not a last resort, just because it has significantly less side effects than opioids, Motrin, NSAIDs, those things. The second thing we say is you can't be a cannabis nurse without being an activist, because we have to walk and chew gum at the same time. We have to know our science. We have to still be nurses. We have to keep our license up. We have to be sure to make all boards of nursing very happy with us. We have to be sure that physicians aren't getting mad at us. And then we have to concurrently be activists in our government while decreasing stigma. It's exhausting.
That's you're dealing with a lot of shit is what we're saying,
Yeah.
and it's ridiculous, the criminalization, just the shaming. With cannabis, it's always viewed as like you're blazed out of your head, or you're sober, and it's like that's not the way it is.
And also, something I want to address, everything you've learned about cannabis, everything, it's all wrong. All of it. So, like, cannabis kills brain cells. No, it's actually neuroprotective. Cannabis makes you fat. No, in a study of 33,000 people, cannabis users actually had a decreased BMI despite increased caloric intake.
I don't know if that's completely 100% true. Well, maybe it's probably more lifestyle, but whatever.
But,
We won't blame the
but
weed.
there's, I mean, like,
Uh,
name a myth, and it gets debunked pretty fast.
like, what about, like, as far as, like, they always talk about respiratory.
Yeah. Also a myth. Cannabis does not increase your chances of lung cancer. It actually is significantly less than cigarette smoking. And weirdly, in a study from 2011, when they did a 7-year study of cannabis users versus smokers, cannabis users not only had not the same risk of lung cancer as tobacco smokers, but they had something called increased vital capacity, meaning that they could take deeper breaths and inhale more air. Scientists didn't really know what to do with that finding because it was not what they expected, and they thought it would either stay the same or decrease, and they were like, they kind of contributed to cannabis smokers take deeper breaths, like that's really in the paper. The worry about the vaping lung disease is legit. Why did that happen? Most likely because of e-cigarettes from the black market and cannabis from the black market. Like, a lot of that was coming from vitamin E that was being mixed with oil to sell it for cheap. The heating device was cheap and broken. And then, fun fact, cannabis and hemp is a bioremediator. What that means is when you plant cannabis in the ground, it sucks up all of the fungus, the toxins. I say toxins, but let me specify what a toxin is. Heavy metals. Um, so you're getting that if you're not getting regulated hemp. I encourage anyone who's like a nerd like me, have a critical eye. A lot of the cannabis research prior to 2017 is garbage. It's self-reporting. The researchers don't ask where the cannabis was procured from. And that means we don't know what was in it, meaning what was found in the case study may not reflect what happens with cannabis. It might reflect what happens when cannabis is cut with fentanyl. It might reflect what happens when cannabis is cut with butane in somebody's basement. So, when I speak to physicians, I'm like, don't take prior to 2017 negative cannabis studies, take them out of your brain, because we don't know. And it's where did you get the cannabis from? I don't know, a guy.
Right.
The studies coming out now are a lot better
Because
because
there's more controls.
and they're international,
Mm.
which they have just better cannabis to do stuff like studies on.
So, Rebecca, I really want to ask you a question. Like, I know a lot of folks who have dealt with addiction in one way or another. The opioid crisis has been out of control for decades at this juncture, and it's ruined a lot of lives. It's bad for folks that have chronic pain, for getting in an accident, sports injury, stuff like that, and can utterly ruin somebody's life. Like, we talk about so many of the benefits of cannabis. Like, where do you see cannabis's role in the opioid crisis?
Yeah. when cannabis is used instead of opioids, people have better outcomes. There's some studies that aren't quite finished yet where globally they're following post-op patients and giving them cannabis instead of opioids. Their recovery is better. And we're still discovering that. So I disclaim with everything, more research is needed. But in a study from 2017, they followed doctors that recommended medical cannabis and followed those patients to see what prescriptions were being refilled and what was happening. Opioid prescriptions dropped by 1,800, which is big. So 1,800 people did not refill their opioid prescriptions. With opioids, again, side effects. You could get a bowel obstruction, uncomfortable, potentially dangerous. Some people have to have a colostomy if it gets blocked that bad. Other respiratory distress obviously is the worst outcome. And then of course nobody, even if you escape those kind of things, nobody wants a life of addiction. So cannabis is a really useful tool, not only to avoid opioids altogether, if they were more widely used and accepted, but also as a pretty good means to weaning people off opioids and other medications too. I have had clients who have real pain, who have real diagnoses. There's no doubt about it. They have chronic illnesses, fibromyalgia, rare pain disorders, and they've struggled for years, oncology diagnoses, and they start on cannabis, and it despite what the industry does a little bit of like movie magic, I say, where the cannabis industry says, like, try cannabis, it does all of these. What they don't say is sometimes it takes time. And with weaning from opioids, that takes time and it takes a team. I can't do it myself. I have to work with somebody's doctor. But for folks who have that collaboration of a cannabis clinician and a physician, I have seen people wean off opioids to go from like 30 milligrams of Norco every 4 hours and then, oxycodone at night to only using cannabis. It takes time, but it happens.
I'm uh, the opioid crisis has touched so many people, folks that I know, people that I've worked with, have folks like that. And the fact that there's an opportunity for a lot of folks to find relief and find some peace with cannabis, as opposed to, so many awful, things, we could be heading in a better direction with the way that we approach, cannabis as medicine. And that's great. We can have like a long conversation about other stuff.
I could literally be here for hours.
Okay, we have to be adults and all that, and what a shame.
Yeah.
But before we go, please tell everybody again how they can get in contact with you. And like, I mean, if you're somebody who deals with chronic pain or
Yes.
don't sleep at night.
Yep. Chronic pain, sleep, anxiety, fibromyalgia, migraines, MS. There's so many things. If you're on a lot of medicine, PTSD, Crohn's disease, ulcerative colitis, sexual health for women, menopause symptoms, endometriosis, PCOS. There's a lot of uses for cannabis. Call me. I will have the uncomfortable conversation with your doctor for you. And I'll work with your doctor. And if your doctor is not open to cannabis, we will find you a doctor or specialist that is. And that's somebody who could be supportive, give you a card, follow your labs, to be sure that you're safe, and you have me to also help keep you safe. So I'm Rebecca Abraham. I own Acute on Chronic. We're about to have about 3 more cannabis nurses and even physicians kind of on our team to help educate and give cannabis care, which is really exciting. You could find us at www.acuteonchronic.com. And then my Facebook is Acute on Chronic, and we are on Instagram at Acute on Chronic RN420 and Twitter at Acute on Chronic. And that's me.
That is awesome. Thank you for being generous with your time. I love having a conversation about cannabis as a medicine and people, finding relief in it. And I love reminding folks that hemp is cannabis too. And it's really important that we look at this as something as a positive supplement in our life. And there's folks out there that can point you in the right direction. Maybe it's not you, maybe it's your mom, maybe it's your dad or an uncle or a friend or something like that who needs some kind of relief. There are good folks out there that are looking out for them and want to help them. All right, folks, that was another Talk and Toke. Thank you once again, Rebecca.
Have a good day. Keep in touch.
Thanks. I certainly shall. Thank you, folks, for tuning in, and I'll catch you at the next episode.
Bye.